several miles and or hours to work. And the frequency and availability of free or low-cost immunization clinics or health fairs are minimal. These barriers frequently translate into low attendance at such events, and individuals who could most benefit from such an offering don't get to participate. Establishing a telemedicine link between communities and a preventive health educator would create an opportunity to offer the educational portion of the old-style community immunization clinic with a larger geographic coverage and more flexibility in scheduling. We anticipate that once this individual becomes established as an expert resource, communities will seek and receive more and more meaningful health education from them. We are currently using the real-time interactive components of telemedicine to assess patients in various stages of a disease process. The cameras available today provide a very clear close-up view of patients and portions of their anatomy. For instance, we are capable of, and are currently working on, projects that view smallpox vaccination sites post-injection remotely and collect follow-up information from the patient and family members. The value of such a program is that individuals who receive a vaccination can receive follow-up information from a specialist without traveling to a centrally located metropolitan center, which may be quite a distance from where they live. Our ability to complete very accurate, comprehensive evaluations and follow-ups for a variety of medical and health problems grows globally on a daily basis. For example, a child living in one part of the country who needs surgery to correct a congenital heart problem that would best be accomplished in a major children's hospital in another part of the country could receive preoperative evaluation via telemedicine, travel once for the surgery and inpatient hospital stay, and then return home for recovery and follow-up, again via telemedicine. Costs saved by such a program are realized in decreased travel, decreased length of hospital stay, and a decrease in the expense of treating a child with a chronic and debilitating illness long-term. Eventually, such an intervention contributes to productivity by assisting an individual to healthy adulthood with the ability to function in the workforce, as opposed to one restricted by a lifetime of illness. This model is replicable and practical in a variety of healthcare programs. Telemedicine links actually decrease the gap between the rich and the poor in terms of direct accessing and preventive care. Distance is no longer a barrier to receiving specialized attention and education. The dollars available for preventive health care go much further with a networked and public health approach to education and intervention than a competitive, repetitive approach to small, centralized groups. In this way, technology becomes just another way to promote and enhance healthy living efforts for everyone.
Let's begin with the first question and answer session. We will try to answer as many questions as possible. Therefore, we ask that only one question be asked per phone call, and that these questions be as brief as possible. You may call the studio directly at the phone numbers of fax which appear on your screen. We remind you to make your phone calls at a distance from the monitor to avoid feedback. First question is coming from Pueblo. Pueblo, go ahead, please. Can you hear the question? No?
Yes.
All right.
Good morning. The question is if to have ISO 9000 certification reduces stress in an organization.
ISO 9000, would that reduce stress or would that increase stress?
Well, I would say that it would reduce stress, but I would like also to stress that ISO 9000 is not enough. Good management practices are really necessary to reduce further stress.
And why should managers be more informed about workforce stress?
Nowadays, especially, they should be informed because in a recession, you have to do the utmost to be efficient and to be competitive. So when you reduce stress, you actually gain in productivity, and nowadays it is much more important than when the economy is not in recession.
Okay. And for next question, we go to Mexico. Go ahead, please.
I'm calling from the Colegio de Bachilleres from the state of Sinaloa, from Guamuchil, Sinaloa. We know that there are several strategies to reduce stress, such as you have recommended in this interesting conference, but I want to make a specific comment here in question. In your experience, what has been the most worthy recommendation to reduce stress in an organization, and what would you recommend for reducing stress in an education environment, in a university, for example?
Well, you know that some positive stress is working well for you. If you have many things to do, so then you find the power to do it and the willpower to do it. But I would say that there is no one measure that you can take, and it is no one step that you can take to reduce stress. What you have to do, it is really many things. What you have to do is make sure that people know where you are going. As a manager, you must make sure that they are working in a very comfortable environment. You must make sure that they really follow a healthful living.
Our next question is coming from Medellin, Colombia. Go ahead, please.
Yes. Good morning. Our question is the following. If stress and its different manifestations is the #1 cause of disease and illness, so it is definite that the body is not sick but the being. For example, a flu can be the result of a saturation of certain aspects, or because of a certain trauma you can have a certain illness as well. So how can an organization detect the causes of an illness if the people responsible for them, that is the managers, are the people that are under more stress on an everyday basis? Thank you very much.
Well, not necessarily. You see, if you are in control, so then you have less stress. The problem is when you don't have control over your work position, you don't have control over your destiny, you don't have control over the decisions made. So one way to follow if the workforce is under stress is to see the incidence of disease. And if you see that many people get sick, you might you might know very well that people are under stress, and you should take decisions at the management level to reduce the stress.
Okay, our next question is from Sabina. Go ahead, please.
I would first like to know if the statistics regarding disease or the level of stress is comparable between countries like Mexico and the U.S. And number two, very coercive and administration, or one that really submits a lot of pressure, would this be something that could bring total quality? And then, for example, it said that employees should be independent in some way. And what conditions must there be to elevate productivity instead of it going down because the personnel is not working because they are so-called more independent?
Well, I think we have several questions in that one question, so please go ahead.
Well, I'm not sure that we have that much information for Mexico to compare the stress level, but I could tell you that people are very stressful, and I think that the numbers between countries may vary a little bit, but stress is present. Now, when we are talking about letting people decide what they do, we don't mean that they will sit and do nothing. What we mean is that as part of an educational process, you like to have auto-control, you have to have really that people determine the phase of work, but they have to complete with the goals. And this is now something that we do in every place possible. We educate people, and then we let them have more authority, and we delegate power to them so they are less stressful.
Okay, thanks for your questions, and let's now move to the second module of our program. Well, thank you for being with us today. I appreciate you being here today and responding to not only my questions, but later on to the questions that will be coming from our audience. Let me begin by asking just a simple question. Why immunology and vaccination is so important in terms of productivity and disease control and prevention?
Well, as a pediatrician, I might start off answering that question by remarking on how successful vaccines have been in preventing disease. In countries that have widespread vaccination, most of the diseases that we immunize against have been eliminated or nearly eliminated. So in the United States, for example, we have seen reductions of around 99% in most of the diseases that we vaccinate for. The most recent examples of that are very relevant to my practice of infectious disease, and that is we have almost eliminated the common causes of bacterial meningitis in children through the use of vaccines.
Great. And how much a lay person, someone who is an educator, a manager, should know about immunology and immunization?
Well, I think it's very important to know what are the consequences of the disease we're preventing, because today in many countries people haven't witnessed severe diseases such as measles, diphtheria, neonatal tetanus. This isn't because of the success of vaccination. So I think it's important for people to understand this and to not let the fears or vaccine scares, the fears of adverse effects, become stronger than the fears of the vaccine itself. And to know also that the greater the percentage of the population that's vaccinated, the more difficult it is for a disease to circulate.
Exactly.
It's important for people to realize that the diseases that we have been successful at immunizing against are still there. Measles, for example. If a community lets the vaccination rates drop just a little bit, then outbreaks of measles occur. Whooping cough remains a major problem throughout the world, even in countries which have high vaccination coverage rates for the vaccine for whooping cough. So it's very important that a large percentage of the population be immunized against all of these diseases to prevent outbreaks from happening.
And why is that not the case? Why people usually stay away from vaccination?
Well, I don't think they usually stay away, but some people are put off by the prick of a needle and so on. But it should be clear that vaccines are among the safest drugs that one can take. They have to be because they're given to otherwise healthy people, often children, and so they're very carefully tested and screened for side effects. So I think it should be clear that if you're getting a vaccine, you're getting one of the safest kinds of drugs available.
And if I could add,
Sure.
also, I think it's important to note that there are fears about being overwhelmed by so many shots at once, or that the immune system can't handle it. And I think it's important to stress that the immune system is designed to handle infections and to handle much more than vaccination, and that the disease itself is actually a much bigger challenge to the immune system.
So it is okay to get vaccinated?
Okay to get vaccinated and many shots.
Not only is it okay, but another feature of vaccines that's important is that they are very cost effective. So for those in the business community or in the business of healthcare, we look at vaccines as a great value for the amount of money that they cost because of the diseases that they prevent.
So it's much better not to get sick to begin with than bear the cost of being ill. Let me change the subject slightly. Why are influenza, measles, hepatitis B priority areas for prevention efforts through immunization and healthy living promotion?
Each of those has a slightly different reason for them being important. I'll start off with influenza. Influenza is an infection that's extremely common, and it affects all age groups, from very young infants to the elderly, and it occurs in all parts of the world. It occurs in epidemics nearly every year in most communities. So as a result, thousands of people are infected every year, and unfortunately, thousands of people die from influenza and the complications of influenza. It has a significant impact on children and their ability to attend school. It has an impact on the workforce. People get influenza, they're out of work for a week sometimes even longer than that. And the elderly are at high risk for severe complications from influenza. All of that's happening when we have a very effective and safe vaccine to prevent influenza. So that's one reason that there's such an emphasis on that particular vaccine, is that it affects everybody. We have an effective vaccine that can be used to prevent the infection.
What about measles and other diseases?
Well, measles is another problem. Measles and hepatitis B are responsible for many of the deaths due to diseases that we can prevent by vaccination. Just for a few numbers, there are over 3 million deaths still every year due to diseases that we can prevent with vaccination. Measles is a particular problem in Africa, in African countries. It's been eliminated in much of North America and South America by effective vaccination, and we have a very good vaccine against measles. And the WHO, the World Health Organization, has targeted measles for eradication, and as most people know, the WHO had already targeted smallpox and polio for eradication. Smallpox was eradicated in 1980, and polio is on its way to be eradicated. So measles is next, but measles being one of the most contagious diseases known to humans, a very high percentage of the population has to be immunized in order to block the transmission. And this is not the case in many countries, and as Mark mentioned earlier, even in the United States, when coverage has declined, we've had, the last outbreak was in the early 90s when there were 50,000 cases of measles because people were not getting vaccinated.
And what about HIV, the dreaded disease that we get as a result of HIV infection?
HIV is a particular problem for vaccination. A lot of work is being done to try and develop an HIV vaccine, and there is hopes that we will succeed in developing one. The problem with HIV is that it changes its characteristics regularly in different populations and over time. So there are scientific challenges and challenges to the immune system in order to develop an effective HIV vaccine, but there's no doubt that that is a very important step in the worldwide effort to combat HIV.
Let me turn to the recent advances. What are some of the most recent advances in immunization?
Well, the more experimental advances are still in the developmental pipeline, but there are many exciting new areas that will be followed up in the near future based on basic research in immunology. As we understand how the immune system works, we can now put that knowledge to work to generate new vaccines. And one kind of vaccine I'm quite interested in is DNA vaccine. So in this kind of vaccine, you actually introduce DNA into the host, which encodes a protein from a microbe, and it can, in certain circumstances, give a very robust immune response, for example, to influenza. But these are not yet approved for use, but are an exciting development that should be coming on in the years ahead.
And what are the timelines on these? 5 years or 7 years or 10 years?
Well, for DNA vaccines, it's more like 5 to 10 years, but for other kinds of improvements, we may see it somewhat sooner, like new developments that will allow one to have an oral vaccine rather than a shot.
Very good.
And I've been involved in some projects recently with new advances in vaccines. One is related to different delivery mechanisms of vaccine. The oral vaccine was mentioned. There's also vaccines that you can administer simply by spraying them up your nose. We talked about influenza a minute ago, and influenza is one such vaccine that is being developed that is administered simply by a nasal spray, or will be in the relatively near future. And that will make our ability to deliver that vaccine much easier in the future.
So these are in medium and short term, and are they worldwide? Are they available to communities throughout the world or in certain areas of the world?
Well, many kinds of more modern vaccines are either too expensive or too labile to be easily available in the third world. And that's why and an added problem for vaccine companies is there's not a lot of profit in those countries. So there is pressure for cheaper and more stable vaccines, which is driving, for example, the DNA vaccine research.
There are some advances that are available throughout the world. One of the activities that I've been involved with here in the United States is the utilization of schools as a site to administer vaccines. All the children are there every day, and it serves as a very effective location to administer vaccines and also to be sure that every child in the school is immunized. That's clearly something that could be applied on a worldwide basis and has been very effective in the United States in pushing up our vaccination rates to the levels that were referred to that we need to prevent the outbreaks of these diseases. The other thing that's being worked on is our ability to keep track of what people have been vaccinated with what vaccines. In the United States, there's an effort to develop a computerized database that tracks everybody's immunization, so that if you go to one doctor and are immunized and later go to a different doctor or a different clinic, that facility can look up your vaccine history and know exactly what you still need to get. That's another type of technology that's generally available in more and more parts of the world, and I think will gradually be disseminated to more places as we see the success of those kinds of approaches.
And where is the best place to get information about vaccination, immunization? What are some of the resources that are available to the public in general?
Well, I think that the WHO, the World Health Organization, and the Center for Disease Control in Atlanta, they have very good websites that have detailed information on the safety of vaccines, on the diseases that these pathogens cause, and also on the vaccine schedules. There are also phone numbers that are available to call, and this is available all over the world.
So the best thing to do is to go to their website, and then I can get all kinds of information.
As a start. The other place to, of course, keep in mind is your own physician. Go to your physician if you have concerns about vaccines or you want more information about vaccines. Physicians have to be up to date on the latest in vaccine types and delivery mechanisms, and they'll be able to answer your questions as well.
Go ahead.
By the way, if you visit the World Health Organization website, you'll get a lot of information that will convince you that vaccines work, because it's very striking how, as new vaccines have been introduced into country after country, you can see the disease rate plummet very rapidly. So I think if you have any doubt as to the effectiveness of a vaccine, I recommend you look at that site.
Is there such a perception problem among people that vaccines may not work or may actually induce disease in people?
That's a very common perception with certain vaccines, including the influenza vaccine. But in fact, that turns out not to be true. But it's the kind of story that passes around from person to person and sometimes discourages people from getting the vaccines that they should get. So I would encourage people, again, to go talk to their physician and someone that they trust to get the latest and correct information about immunizations and their benefits.
So that's on an individual level. As an individual, I should talk to my physician, consult with him or her on a regular basis about these issues.
Yes, on an individual basis, the physician is the best person who can advise you in terms of, for adults, for children. I think it's very important to stress that there is adult immunization that's necessary and that saves lives. We touched a bit on hepatitis B, but this is also a major cause of loss of productivity, of disease. It causes liver cancer and cirrhosis later in life, in adult life. And it's very important. There's a vaccine available that's quite safe, and it's very important to talk to your physician about this.
And following on the theme of productivity, as a manager, as someone who is responsible for other people, what is my role in keeping my flock, my folks, disease-free?
Well, I think it's important to provide them education and information about vaccines, to encourage vaccines. There's no question that an unimmunized workforce is one that is not as productive as it could be. Influenza is just one example of that. I'm glad Denise brought up adult vaccinations. I think the future challenge that we face across the world is effective immunization of adults. We do a pretty good job with children, but there are many adults who are not immunized as fully as they should be, and there are some new vaccines being developed which are targeted directly for adults. One example is the whooping cough vaccine, which typically we have only given to children. But recently we've learned that whooping cough affects adults as well, and they sometimes spread the infection to their children. So in order to protect everybody, I think it will become important to immunize adults for more and more things. So as a manager, I would recommend that you become knowledgeable about vaccines and share that information with your employees.
Are there any examples of organizations or companies or even countries that are more proactive in these areas?
Well, I certainly know in the United States there's been an increasing effort to focus on adult immunization, mostly headed up by the CDC. But health plans in the United States as well are looking at this question, because from a health plan point of view, they would much rather have their health plan members immunized than not, because otherwise they end up having to foot the bill for the diseases that they get later on.
Absolutely. And what are some of the impediments for adults? You said that adult immunization and vaccination is a lot less than children. What are some behavioral impediments? Why don't we get immunized?
I think vaccination is seen as a prevention mechanism for children and not for adults, and that adults figure they'll get sick, but it won't be very serious. But I think if we come back to influenza and just looking at the numbers, if I may, again, there are between 20 and 40,000 deaths a year due to influenza in adults in the United States.
That many?
And that many. And it's much more than people think. And this is adults, mainly in adults. So I think that it's very important for adults to realize that there is vaccination after childhood.
The other problem is many adults, unfortunately, don't visit their physician as often as they should. Children are, or the parents of children, are in the habit of bringing them in for routine checkups. But adults, once they get out into the workforce, tend to forget about that. And so they lose the opportunity to be informed about vaccines and have the opportunity to receive them through a routine visit with their physician.
So how often do I want to do that? Is that something that I want to do annually or twice a year, or what is the time period for that, for me asking my physician about this?
Well, for asking the physician, maybe if you have access to, for example, the flu vaccine, why not get it? Many employers offer it, and one should take advantage of those opportunities.
And it very much depends on your individual situation. There are certain conditions or diseases that make immunizations very important for adults. And so I would encourage everyone to at least have a first visit with their physician to talk about that, and then they can let you know whether you are at high risk for certain of these diseases that would make vaccination even more important for you than for somebody else.
So as we're winding down our interview here, is there any particular topic that we should address at this point? Any new ideas or information, for example, about HIV or any of the new developments in the field that you want to comment on?
Well, there have been some recent clinical trials of HIV vaccine which have failed, and so I think with that particular disease we're still a long way from an effective vaccine, although there's intensive research. But perhaps in some of the other viral diseases there's more progress.
Yes, I would like to mention that if you look at the whole pharmaceutical research and development budget, it is quite a small fraction that's devoted to research in vaccines. It's about 2 to 3%, and much more in treatment. So I think there's also a problem in terms of the profit gained by treatment and in terms of prevention as being much more cost effective than any treatment will ever be. So there needs to be more effort put into vaccine research.
And even with those small budgets, there are a number of new vaccines that are coming that will probably get here before an HIV vaccine gets here. And as a physician, I'm very excited about those prospects, because each time a new vaccine comes out, that's one less child that I have to see who has that disease. So I think the promise remains bright for vaccines. They are very safe, they are very effective, and they're very cost effective.
Well, we thank you very much for your insights and for your comments, and hope that you would come back and share more information with our audience. Thank you.
Thank you.
Thank you.
And we will now continue with the second question and answer session. Our first question comes from Santo Domingo, Dominican Republic. Go ahead, please.
Be a glitch in the communication. I think we might have to take another question.
Okay, apparently Santo Domingo is not online, and we're going back to Mexico. Go ahead, please.
Do you consider that participation at all levels of the organization, from labor workers to administrators, if everybody participates and promotes hygiene and different measures, would this improve the stress level in the organization and thus reducing the risk of organizational accidents in the work, and then would improve the overall well-being of the organization? Do you think this would be the case?
Okay, we are still on the topic of stress. However, we have changed the subject, but go ahead, please, if you will.
Well, I'm not an expert on management, obviously, but it seems to me that any manager would want to set an example to his employees in anything that he feels is valuable to the organization. So obviously, I would think that anything to do with healthy living should be an organization-wide effort.
Exactly. We go back to Santiago, actually Dominican Republic, please. Go ahead, please.
I would like to hear a comment on the poliomyelitis post-vaccine. If you could please comment. I would like to hear a comment on the genome specificity and the poliomyelitis after the vaccine, post-vaccine, please.
Well, I guess I'll answer that question about poliomyelitis, which is a good question. Indeed, as you know, the vaccination against polio has has eliminated the transmission of wild-type polio, and there have been some fears about polio related to the vaccine, and this has occurred. It is a very rare event, a very recent event, and it is being investigated. Particularly, you may be speaking about the Dominican Republic and other areas in that geographical region. And there is no cause to be alarmed, and the oral polio vaccine is in the process of being switched to the inactivated polio vaccine.
Right, we go to Mexico City for our next question. Go ahead, please.
Técnico Nacional. Adelante. My comment is the following. It's true that we're afraid of certain vaccines, and this due to the pharmaceutical companies send their human tests to developing countries like the Latin American countries, for example, or Asia, to know the consequences or complications. Do you think that this position is ethical? Thank you very much.
Well, ultimately, all drugs need to be tested on humans at some point, and so there is those people participating in such trials should be aware of what they're doing, and in this country, at least, one needs some sort of written explanation of the potential costs and benefits of participating in a trial, and obviously that may vary country to country. But I think it would be unethical if one were to participate in an experimental drug without knowing the risks involved.
Great. We are staying in Mexico for our next question. Go ahead, please.
The question is related to how does stress and productivity relate to the possible war that is starting, and the relationship between obesity that the World Health Organization in London related to stress. What is that correlation?
I think, again, we are on a different topic at this point, but we can all generally relate to what is going on in terms of the war, anxiety, and maybe even obesity. Who would like to comment on that?
I'm not sure of the relationship between war and obesity, but I'd be interested to find out. I mean, obviously, stress does affect the immune system. It does make us less resistant to infections. But I should also mention that one can get fairly severe infections when one is not under stress, and this further reinforces the benefits of vaccines.
We're going to try Santo Domingo, Dominican Republic again. Go ahead, please. I think we are still having trouble with Santo Domingo.
Could you comment in regard to the vaccines that companies should promote to combat an influenza?
All right.
So I think I missed the beginning of the question.
Could we repeat that question, please?
What measures would you comment on the company's measures that could combat the influenza, to stop influenza in the organization?
Okay, how do we, as an organization, how do we approach that problem?
Well, I think influenza is something very straightforward to approach, in the sense that there is a vaccine that's available every year, and an organization can promote vaccination of its employees, and this has been shown to be directly linked to productivity.
And how is that usually taking place in organizations?
The ones that I'm familiar with, they're usually a day or two. The employees have access to an immunization site on the campus of the company, and it can be done very rapidly. It's not very painful, and you're fairly well protected for the remainder of the year. These are typically given in the fall season, before the flu season.
Okay. We go to Sinaloa, Mexico for our next question. Go ahead, please.
I'm Dr. Maria Trinidad Cárdenas Ponce from the Development of Human Development in the University of Sinaloa. Do you think that telematic education would be a good option to improve health in the workforce? And what would be the healthcare professionals that would be more indicated to conduct a integral healthcare program?
Well, our telemedicine expert is not on the set, but I think that we can all relate to the effect of telecommunication and its use in healthcare. Any comment on that?
I think there's no doubt that it is a very effective means to communicate with the workforce about health issues. And depending on the nature of the company and the healthcare professionals that are on-site or off-site, physicians or nurses or other healthcare professionals would be very appropriate to conduct the training.